right? Okay, so if you see, there are three levels of prevention, as I told yesterday. So here we'll be seeing the types. uh, I think I've already told this yesterday itself anyway. So three types, like primary prevention, then we have secondary prevention, and then tertiary prevention, right? So this three. So if you see this three, the first one is primary prevention. So from the name itself, you can understand what primary prevention is, right? So it is defined as a measure take against the onset of a disease, like we know there is a few virus or bacteria that causes a disease. So what we do is, we understood it that it can cause a problem. So what we do is, we create a vaccine and make ourselves immune to that particular disease, right? So a best example would be the polio vaccine that you would have taken in your childhood, right? The second one is secondary prevention. This is the prevention that we do to arrest the progression of a disease. For example, the best example would be the paracetamol tablet that we take in case of fever, right? So while talking with considering rehabilitation, we can say the best example would be ergonomics intervention, right? I had already told what ergonomics is, so I'm not going to go into it now. So next one is tertiary. Tertiary is the disease has come. Now we couldn't control it, so we are trying to cut down its consequences, right? So the best example is the present day scenario with respect to coronavirus, the COVID-19, or when it uh, the best example in terms of rehabilitation engineering would be the pressure pose in paraplegic patients, right? So this one you would have already seen in the yesterday's slide itself. So next is the economic impact. So how it impacts is that if the patient is rehabilitated, they have to be self-dependent, right? They should not have anyone else to take care of them. They should be self-dependent. Then second one is set free the that is not table, it should be able. Sorry for the mistake. Set free the able-bodied person. Like once we have rehabilitated the person, he has to be free, right? So he have to go around and take care of his own course, right? Then uh, breadwinner is the one who takes care of the family, right? So the winner, if rehabilitated, he can able to take care of his house, right? So this will help the other spouse in supporting the family, right? So you should always know that a handicapped individual means handicapped family, right? So as a rehabilitation engineers, we have to make sure that the rehabilitation is done in such a way all these things have been addressed, right? So these are the terms that we have come across oftentimes, but we fail to understand the real meaning of these terms. Like we know, we have heard about impairment, we know disability, we know handicap. Do you know what is the difference between these three terms? Already I have shared this slides in Google Classroom. Any idea how they are different? The difference between impairment, disability, and handicap? Any answers? If you have any answers, you can put it in the chat box. Difference between impairment, disability, and handicap, right? Okay, so we'll see. Impairment is a loss or abnormality of a psychological or physiological or anatomical structure. Okay, let's say a person loses a finger. Okay, that we can call it as impairment. Then what is disability? Disability is a restriction or lack of ability to perform an activity, right? So as a result of losing his finger, if he cannot able to do a specific task, then we can consider that as a disability. His inability to do a work or inability to perform a certain function, right? So the losing a finger from impairment will become disability. Then what is handicap? Handicap is same disability, but it will result in the person's inability to perform in the society. Or you can read from this slide. It is a disadvantage for a given individual in his or her social context resulting from impairment or disability that limits or prevents the fulfill of a role that is normal for him or her, right? If he cannot able to do the societal work that he used to do, right? So this we call that as handicap, right? So okay, I think this will help you understand much better. So if you see the dark black circle, it is impairment, which is losing a organ or a tissue, right? So if it restricts him from doing work, that is highlighted in the dark gray circle, it is considered as disability. If we cannot able to do function in the society, then he will be considered as a handicap, right? So our government has like identified 6 different handicaps. Those are, you can see from the slide: locomotor handicap, visual handicap, hearing and speech handicap, cardiopulmonary handicap, intellectual handicap, and emotionally disturbed handicap, right? So I hope you all know the meaning of this. You know what is locomotor handicap, right? You can see from that small icons that I put on the bottom of that particular slide. Locomotor is like you, the ones who cannot able to use your limbs, both legs as well as your hands, right? So we call that as locomotor handicaps. Then visual handicap, you know, blind people. Then hearing and speech, deaf and dumb people, right? Okay, then cardiopulmonary handicap, or the people who have stents and other prosthetics or orthosis inside your heart and lungs. Then intellectual handicap is people who are not advanced mentally, right? If you see a 20-year-old individual will be thinking like a 5-year-old individual. Emotionally disturbed is having mental issues, mental problems, right? So these are all considered as handicap by the WHO, World Health Organization, right? So next is diagnosing, right? So we have to diagnose what kind of disability a patient is. The reason is this will help us in knowing like uh, what kind of disability a particular person is possessing, and what all can be done to uh, encourage his lifestyle, right? So if you see, these two things has to be taken very very carefully. First one is that very careful examination must be done regarding the evaluation of disability. There is a typo there, that's not fine, it should be done while taking an examination or while evaluating. There should be, we should be very very careful in identifying his disability. Then second one is patient must be treated as human being rather than being called as cases. I hope you all can relate this to a movie. Anyone remember what the movie is? In one particular movie, it's a quite famous movie, a patient will be called as a case rather than being called as a human being, not in zombie. It's a Tamil movie. Yes. Thank you, Sureka. Vashul Raja MBBS. If you remember that movie, uh, the doctor will be addressing that patient as a case, right? He will be in a coma. The doctor will be addressing that particular patient as case, but then hero comes in and will be like, don't call him case, and then all those things will be there. That is actually true in cases. Those patients should not be called as cases. They should be considered as human beings and addressed as human beings, right? So see, next comes how we are going to or how or what is going to make us call them as disabled uh, people, right? So to do that, we have two kind of evaluation. One is disability evaluation, the other one is functional diagnosis, right? So both are almost same, but they're not same actually. There are differences. I want each and every one of you to listen to this very carefully. First one is disability evaluation, the second one is functional diagnosis, right? So what is it? What is disability evaluation? It is calculating the amount of disability, right? Let's say a person cannot able to talk, or if we cannot able to walk, we have to like calculate the amount of disability, right? Then how we are going to do is doing this examination that I put in the slide. First one is physical examination, then orthopedic, then psychiatric, and neurological examination. I hope you all know the difference between these things: physical, orthopedic. What is orthopedic? Orthopedic. What is orthopedic? Ortho. Good. Thank you, neuroengineering. Then psychiatry. It's a different uh, section. I will come to that later in the slide. and upcoming slides. The neurological, what is neurological brain? Thank you, and to thank you, Sureka. Okay, thank you, people. Next, why we are going to do, I mean, why are we doing this examination is to tell them if they are really disabled or not. The use is that to understand or to give them an eligibility so that they can make use of government concession. If you have, I don't know if you have heard this, but people who are handicapped will get some kind of concession from government. You have heard this in the news and all. Okay, so to get that concession, there should be some certificate saying that these people are eligible for that concession. We have seen this in government buses and trains and all. This like the seats are reserved for disabled people. So while booking that particular disabled people's ticket, we'll have to show them this certificate to be eligible for the government concession and other concessions, right? So this is disability evaluation. So listen to this very carefully. Here we are evaluating the disability, whereas in the next one we will be calculating the functionality. Okay, here we are diagnosing the functionality. In the previous slide, we saw disability. We measured the disability. Here we are measuring the functionality. Hope you know the difference between disability and functionality. It's quite opposite, right? So what are we doing here is we are measuring the amount of remaining function. If let's say the person has a problem with his limb, in the first one we will be seeing how bad it has been damaged. Here we are seeing what else can be done with this with that damaged part, right? So the professionals are to be trained very well to diagnose and find the residual capacity of the individual to perform various activities, right? If at all he can do even a little bit of work, that has to be recorded so that we can categorize him in different category and give the needed treatment. Okay, so these two are important. Keep this in mind. Maybe by the end of the class or by evening I will be giving another quiz. Quite sure this question will come, the difference between disability evaluation and functional diagnosis, right? So next, the functional diagnosis that we take up must follow all the steps. First one is it should be objective, second one is descriptive, third one is simple, then reproducibility, and the fourth one is comprehensive. What is objective? What is subjective? Objective is like we are concentrating on the particular thing. Okay, thank you. Aim. Okay, here the contextual meaning here is, anyway, thanks Daniela. See here what we are meaning is we are uh, taking care of that particular disease or particular disability without getting biased, right? Let me try to, we'll come back to that later. So objective means that is we are going to treat or we are going to diagnose without getting biased, right? The second one is descriptive. Descriptive, you can see actually all these things, the objective, descriptive, comprehensive, all would have come in your question papers. Objective is 1 mark, then descriptive is brief answer, then comprehensive is a detailed answer, right? Similar to that, objective is without any bias, we are concentrating on particular diagnosis. Descriptive is learning bit more, right? So that we will have a accurate result. The third one is simple. Simple is like if you diagnose a patient, the treatment, the way we diagnose should be simple, so that if any other person comes and measures, you should able to do it, right? That is same with reproducibility also, right? The treatment method that we use should be simple as well as it should be able to be repeated. It should be repeatable, right? Then third one is comprehensive. Comprehensive is like we will be studying a particular method or the diagnosis, but we will try to uh, get information or get all the information that are affected or relevant to its epidemiology, right? I hope you all know that what epidemiology is, right? So let's see. To make this slide a little more understandable, I will rewritten this. See, objective is based on the observed facts. Descriptive is describing the complete analysis. simple as usual. It will help us in doing the test very fast, that is rapid. Then reproducibility, we will get constancy. Be very careful in observing this word. It is not consistency, this is constancy, which means that no matter how many people comes and do this diagnosis, the result will be constant, right? So that constancy should be maintained. Then comprehensive is broadly and completely studying that particular disease, right? So we'll try to give an example here. Cerebral palsy. uh, Anyone have any idea what cerebral palsy is? Any idea what cerebral palsy? Oh, okay, so cerebral palsy. uh, okay, cerebral palsy is a disease which is often seen in children who has some problem in their brain, so that they cannot able to do normal tasks, right? So if you see that particular disease, it is found to be affecting in this three, there are actually this three, there's four types. Okay, one is spastic, then one is ataxic, then dyskinetic, and the fourth one is mixed type, right? So remember this five things: objective, descriptive, simple, reproduce, then comprehensive. We try to apply that here. First one is objective. So objective is we are going to study only this particular region that is being highlighted, right? So what is the region? What region is this? What is the what region is this? The region that is highlighted with red circle. Cerebrum. Okay. I actually wanted the region like it was studied in biomedical instrumentation as frontal region, occipital region, central region, occipital. No, good. It's temporal region. Thank you, Dina. It's actually temporal region. Temporal regions are the one on the sides. Okay. Remember, temporal something related to your ear, hearing. Okay. Okay. So not get deviated. So here, the highlighted region is temporal. So we will be studying about the temporal. When objective, will be studying only about the temporal. We will not get influenced about the occipital region or frontal region, right? So that is objective. Then second one, descriptive. Descriptive in sense we'll be studying the completely about that particular region. If you take this region actually comes under dyskinetic region, right? So it says that 6% are characterized by this. 6% of the total population affected by cerebral palsy are results in this dyskinetic issue. So what they'll do is they will try to study what happened with dyskinetic to other person, right? So they'll have a little more broad study compared to the objective study. Then the third one is third and fourth is pretty simple, so I'm not going to explain it. The fourth one is comprehensive. When it comes to comprehensive, the study gets expanded like this. So observe the red highlighted region. Initially, it was only in the temporal region. When it comes to comprehensive, we will be studying the complete brain. Right? We will not restrict only to the temporal region. We will study what are the factors that are affecting that particular temporal region. Right? We know that temporal region is connected to occipital. The temporal region is connected to your parietal region, your frontal region. Right? So temporal, which organ is connected to your temporal region? Which organ? Just told. Yes, ear. Right. So thank you, Anton, Saranya, Surya, Shanchana, everyone. Thank you. See, as you all told, it is connected to ear, right? So if you hear something, what will you do first? You'll obviously turn your head, right? So for turning your head, there should be some command coming from your brain, right? So that command actually originates from your since it is associated with more movement, it is actually it takes place in this region. Okay, we call that as motor cortex region, right? It is responsible for motion, right? So when you turn, what will happen? Your eyes will try to focus on the region from where the sound came, right? So then this region will get activated, the occipital region, right? So in comprehensive study, we will try to learn little bit more, little elaborate, right? So remember all this thing while doing a functional diagnosis. We should do all this kind of studies. First is objective, second one is descriptive, third one is simple and reproductive reproducibility test, and the fourth one is comprehensive. Right? Okay. Now comes multiple disability from the multiple disability. I hope you can understand what this term means. Multiple disability is people with more than one disability. Right? So at the time when the author was writing this book, 12% of the individuals with disability suffers from more than one disability. Right? 12% of the individuals with disability have more than one disability. Like if he is deaf, he can also not able to see. If he is like if he cannot able to see, he cannot able to like talk, something like that. Right? So this in this many individuals, they suffer from more than one disability. Like same example I'm going to give you, cerebral palsy. And if you take cerebral palsy, if the disease is not treated properly, if you take the same example, if this region is affected, and if the progression goes here, then the uh, visual capacity of the individual also might get affected. Right? So that is why we can also consider this as a multiple disability. Right? Right. So if you take, we can categorize this disability into two types. One is, anyone wants to say anything? All right. So we have two types of disability. One is primary, second one is secondary disability. So it's actually quite simple and straightforward. So primary is, these are all the direct consequence of a disease or condition. Right? So if you fall down and broke a limb, then it is a direct consequence. Right? If there is a disability caused through direct consequence, we can call that as primary disability. So secondary disability, it does not start, from the origin or from the fall, but it is a resultant of primary disability. If the primary disability is not properly taken care of, it will lead to this secondary disability. Right? So the best example here would be for primary disability is paraplegia. What is paraplegia? Paraplegia. What is paraplegia? We are running out of time. We have only 8 more minutes left. Paraplegia. Upper limbs affected. Yes. Okay. Thank you, Patricia. Paraplegia. Yes. It's actually either two limbs or two legs. Okay. Pair. Something like two limbs or two legs. Then there are another category called as paraplegia. And there is hemiplegic. So many categories are there. Here, the example is, if someone, let's say someone met with an accident and if he couldn't able to walk, we can call that particular individual as a paraplegic individual. Right? So that is primary disability. Let's say this paraplegic patient, if he is to be treated, he obviously have to sit in a wheelchair. Right? If that particular patient sits in a wheelchair for more than 2 hours, or let's say these people, they have no other food, they'll have to obviously sit in a wheelchair. If they sit in wheelchair for more than like 8 hours, what happens is that his muscle will get loosened. Right? He will not be using most of his muscles, right? His leg muscles. Let's say he has paralysis of his legs. So in that case, he will not be using his leg muscle. So what will happen is his muscle will get wasted. We call that as the disuse atrophy. Right? So that category is considered as disuse atrophy, which is wastage of muscle, which is a secondary disability. Okay, so understand this very carefully. First, primary disability is direct consequence. Secondary disability is a result of primary disability. Right? So we'll move to the next slide. So this is a vicious circle. So see, if you're inactive, if there is reduced activity, what will happen is the muscle activity will also go down. If there is reduced muscular activity, there will be a reduced functional capacity of musculoskeletal system. If that decreases, then your cardiovascular function will also reduce. If cardiovascular function reduces, obviously the body will lose its normal condition, it will ultimately lead to complete inactivity. Right. So this is very important diagram. I want each and every one of you to uh, memorize it. It's quite straightforward. First is, if you are inactive, the muscular activity will be low. If the muscular activity is low, then musculoskeletal system will also, the function of musculoskeletal system will also be low. If it is low, then the cardiovascular system, that is the use of blood, use of oxygen through heart, will also get reduced. As a result, the body will lose its condition, and returning, leading to even to the extent of death or removal of the complete region. Right. So we'll move to the next slide, which is the goal of a rehabilitation engineering. So this are all quite straightforward. Like rehabilitation goal, first one is orientation. Orientation is how he can like uh, get accustomed to the environment. Second one is physical independence. Our goal is to make him completely independent of any other needs. Third one is mobility. He or she has to able to move from here to other place without any support. The third one is occupational integration. Is we have to give them enough treatment so that he can take care of his occupation and he can set into that particular environment. Then the next one is social integration, is how he can contribute to the society without without any other help. And the fourth one is economic self-sufficiency, how he can earn for himself. So these are all the goals of rehab. So go through it, and it's already there in your textbook, so you can go through it. The next one is the team. Okay, now tell me, who are all responsible for rehabilitation? We have 5 more minutes left. Who are all responsible for rehabilitation? Engineers. Okay, thank you, Satya. Doctors. Okay, biomedical engineers. Yes, exactly. Physiotherapist. We are also, yes, we are also, of course, we are part of the team. Here, what they are going to, what they have done is they have actually categorized the team into three. Okay, one is medical team, second one is paramedical, the third one is socio vocational. Okay, now tell me, under which category we biomedical engineers will come in? Will we be considered under medical or paramedical or socio vocational? Yes, thank you. And Saranya, we all come under paramedical, right? So who all will come under medical is obviously the doctors, but not all the doctors were considered here. Thank you, Divya, Anupradhiba, Manikandan. Move to the next topic, which is what are what kind of medical team? Okay, as I told earlier, we have medical, paramedical, and socio-vocational, right? So in medical, this are all the team that we are expected. Not all doctors can come under, but certain group. Right? We have some 1, 2, 3, 4, 5, 6, 7, 8, maybe some 25 people in medical team. Then in paramedical, again we will have some 15. Then we have something called a socio-vocational. We'll have some 10, and again we have another interesting thing: play and drama therapist, which will also come under paramedical, right? So I'll explain each and every one here, but unfortunately we don't have time. So I want each and every one of you to type your roll number in the chat box so that I can mark your attendance. Type your roll numbers. I'm sorry, don't type your roll numbers, type your university register numbers. It's quite hard to follow your roll numbers, so please type your university register numbers in the chat box. Done? Billy, please type a complete number. Thank you. All right, fine. So hope everyone have completed it. So எல்லாம் டைப் பண்ணிட்டீங்களா? Okay, now I will save the chat. Okay, right. So go through these slides. Like yesterday, I will be giving another link to attend the quiz in Kahoot. So please attend it. Yesterday, as far as I've seen a couple of hours ago, only few of you have completed that quiz. I want each and every one of you to attend the quiz. If you could not download the app, you can try in Google Chrome itself. So try it, okay? Okay, again, go through all the slides. I will upload this in your Google Classroom. Go through this. The question will be mostly based on this, right? So if I complete explaining the different roles, like who are all the doctors, who are all the paramedical staff, this unit will get over. So go through it, right? Okay, thank you. You can leave now.